Greetings and welcome to the lecture on Chapter 8, Critical Issues, what we find who is most vulnerable if adults drink. We're going to also look at, in this lecture, family survival roles, and part of what we're going to be able to see is the different types of roles that play, and this handout is uploaded onto the Blackboard side. So some important statistics to look at is that studies show that ETOH, which is an acronym for ethanol, which is alcohol, of course, is a factor between 38 and 60% of child abuse cases. In 1990, 675,000 children were mistreated by a drug-abusing parent, and it becomes a cycle because then that child, if they're neglected or abused, then they are going to have ineffective coping skills to navigate life, and then we have a high chance of going on into their life and also being abusive in their relationships, have poor coping skills, or will go on to abuse alcohol and drugs. Also, we look at it as a learned behavior. As a learned behavior, we know that many young children and adolescents learn that drinking alcohol is acceptable by the roles that are in the household. Child abuse is often looked at as being a biofeedback or a symptom of in the home where parents are abusing alcohol and drugs. Bradshaw delineates that sexual abuse involved in families into four categories. There's physical sexual abuse, which is any kind of touching in any sexual way, ranging from inappropriate hugging, going on to actual overt sexual abuse, involves voyeurism or exhibitionism, where a child is made to be inappropriate in pictures. Covert sexual abuse consists of verbal expression of inappropriate sexual comments and discussions or name calling, which is verbal sexual abuse, and then boundary violations, which we talked about in Chapter 6 with those rigid boundaries or diffuse boundaries, where inappropriate touching may lead to what it becomes a sexual act. Includes where children may witness their parents engaging in sexual acts, or allowing children to walk in on them in the bathroom, or seeing them nude. Emotional sex abuse involves a parent inappropriate bonding with a child to get his or her emotional needs met at the expense of the child. And this can go, it can be as limited as the mom who's trying to live vicariously through her teenage daughter, and therefore has inappropriate relationships with the daughter and the friends, drinking and doing drugs with the friends as well. All of these types of abuse can scar and lead to a pattern of abuse, where it is a cycle of abuse within the family, and then also substance abuse to deal with the scars, emotional, physical scars that are left from this type of abuse. Shame for the family. Shame whenever this type of situation is in place. In other words, guilt says, I've done a bad thing. What shame says, I am bad. For themselves, not worthy, not worthwhile, inadequate. I've done bad things versus I am bad. And what can happen because of this? A person may not be able to adequately deal with the feelings of shame, and therefore may turn to alcohol and drugs. According to Kaufman, shame stems from a single developmental process that takes a pathway either of a healing or healthy self to a shame-bound self. If a child's basic needs are not met by the parents, the child internalizes that failure as a personal failure, and the child takes on shame. And we're going to see shame when we go back to the family survival roles in just a minute. We're going to see shame listed in under almost all of the different family survival roles as an underlying factor. Also, domestic violence, 60 to 70% of the cases that happen involve alcohol and other drugs. Now, as a domestic violence specialist, I will say this, that while alcohol and drugs may be present power and control in a domestic violence relationship shows that batterers will drink or use alcohol or other drugs to mask the severity of the abuse, or what we see is that when alcohol and drugs is present in a physical abuse situation, that the abuse is almost always more severe. Also, there's a presence of denial, minimization, and blame that comes forward in these type of situations, where a person may be in early middle or late stage alcoholism. And in middle and late stage alcoholism, we know that those stages of alcoholism are marred with blackouts, and a person may say that they don't remember the abuse that happened because of blackouts. We know, of course, that any domestic violence case is based on control. What effect can this have for the family? It can, especially if we've already got the chemical dependency controlling the actions of the family. If we add domestic violence in as well, then the family may feel very limited in options in which that they can express themselves, and that's where we're going to segue to in just a minute with the family survival roles. What happens is that children learn to live with chaos. Families living within the chaos of the items mentioned develop styles to cope. However, the frame of reference of the family is distorted. Each member can respond differently, but there are a few patterns that exist. There's no real acceptance or way to know or understand how to interact, because there is no set norm in the family. The family's norm is chaos or crisis, and therefore the family begins to take on family survival roles in order to develop a insulation and how to deal with the substance abuse or domestic violence that's taking place in the family. These family survival roles, while assumed as a adolescent or child, may become a part of the emotional framework for that person and be so integrated into their personality that when they segue in from young adulthood into adulthood, they may never fully get to a point to where they work past these issues. In other words, they may have their family survival roles on in their new family as they're in the early stage of development with their new family, and never or it may take some time for them to shed the family survival roles that they developed growing up. Now, true feelings are repressed because of the dysfunction, cannot be fixed by the person. The survival roles are a defense to cope with the pain, and the roles help maintain homeostasis, and that's what we're going to see. With these roles, the barriers go up, and we see that I'm going to go through these roles kind of quick here, and then we'll look at the graphic picture that I have that describes them. There is the codependent, the enabler, someone who acts in a way to shield the addict from negative consequences, usually the wife or the spouse calling into work, making sure the bills are paid, pulling up on any projects that may need to be done. Also, insight is never gained by the addict because the addict doesn't realize any things are going on. The difference between enabling versus codependency is enabling is a point where the addict, the family member, allows the addiction to continue by making sure that financially and even from an emotional standpoint that the addict can remain having access to their chemical of choice. But codependency is when the family member relates so much of who they are that by enabling, the chores of enabling become a part of the personality traits of the family member. Now, blocks the reality of the dependence, and the problems being hidden prevent recovery, which is why Al-Anon is so important for wives, husbands of those who are chemically dependent. The family hero is the one who may take on the role of the parent, usually, and in some cases, the oldest in the family, sees the problems more than the other siblings because of their age, in turn feels responsible for taking care of the younger children, may try to improve the family situation by getting a job at an early age, or helping out with chores, may try try to overachieve to make others proud, be an example that the family is okay by overachievement, may become an adult who puts needs ahead of their own, some evidence that dependent spouses are seeked out. In other words, this person has gotten so comfortable in this role in their relationship that growing up, that when they go on to seek out new relationships in adulthood, that they will seek out those dysfunctional relationships, someone that they can save in essence. The scapegoat is the visible tip of the iceberg, that things are wrong. It's the problem child, demands attention, takes the focus off of the addict. Sometimes they like the attention, whether it's positive or negative, acting out at school, or doing things to take the attention off of the addicted. Behavior may cover hurt inadequacies, silent anger turned inward. And how does this help us in therapy? Well, because if we know that this person, you may have an addict in your groups that when that addict was a child, they were a child of an alcoholic. So they may be an adult child of an alcoholic acting out in chemical dependency on their own and never having looked at that they learned their use of alcohol or drugs from a family member, their parent, mother, or father, and then this is what makes the process of the family genogram and all the other things that we do in chemical dependency counseling as it relates to family so important, so that we can map out the framework of the individual as well as mapping out their interactions with their family. The mascot is the class clown, tries to bring fun to the family, entertain, distract, and relieve tension by making jokes or bringing about laughter, learns that the best way to relieve tension is through laughter. The lost child is like the scapegoat, feels insignificant to the family, withdraws from the family, and becomes solitary. Not making close contact may produce problems as they get older. This is a person who may be the loner, quiet, and perhaps involved in fantasy. One caution about this is that this person may go on to live a life of solidarity, and also this person may be so cut off from people that they would be fall victim to suicide. This person attaches to items, not people, things, not people. Also, and then finally, adult children of alcoholics. This is a lot of this that we've talked about in this lesson today is the framework for family therapy in outpatient as well as DWI intervention courses. We learned that the adult children of alcoholics are those who have these family survival roles and then don't shake them, don't learn new coping mechanisms, and then these family survival roles move into adulthood with these youth and adolescent and children. Not all developed problems are fit into categories. Adult children of alcoholics grew up in chaotic environment and needs may not have been met, and they've learned to live in crisis. Problems with intimate relationships, rejection, abandonment, and low self-esteem, and other psychological problems may develop in adulthood if these issues are not identified and work through. Okay, so if we look at the family survival roles, we have the scapegoat, which is the problem child. On this chart here, it's listed as, on the outside, hostile, defiant, rude behavior, and trouble. On the inside, rejection, hurt, guilt, jealousy, and anger. With the lost child, we see that the forgotten child on the outside, shy, quiet, solitary, mediocre, attaches to things, not people. Inside, rejection, hurt, anxiety. The victims, the chemically dependent. On the outside, hostility, blaming, manipulation, aggression, self-pity, rigid values, and charming. On the inside, shame, guilt, fear, pain, and hurt. The family hero, the caretaker of the family, a good kid, high achiever, The following rule seeks approval, very responsible. On the inside, guilt, hurt, insecurity, the chief enabler, and the mascot. And those letters are a little too small for me to read. So this will be uploaded in the same week as this lecture in the weekly folder. It's the My Family, Your Family picture. That's going to conclude this lecture. I look forward to seeing you in the next one.